Welcome everybody to the second annual ACURE meeting. This is a wonderful venue, so thank you to Abumed for organizing the meeting and putting us in this beautiful location.
If you look at where we were last year and where we are this year, the thing that's very exciting is how fast this field is moving.
In the past 12 months, we've made immense progress in the field. When we had the first meeting last year in Rome, I think the tone was set.
All the studies we were talking about last year have just come into reality this year.
And there's a lot of us that have been working on unloading and recovery for an extended period of time. The concept is now starting to become accepted and more mainstream.
The community was willing to adapt to the concept of unloading, starting to do much more independent studies that actually enlighten us in different ways of acute unloading.
This is a forum where people who are interested in this, not only interested but actually working intensely in this field, have a great opportunity to get together and to really share ideas.
So pre and lactate.
So a poster session is an opportunity for an exchange of ideas, new abstracts, new concepts, and there's been, I think, a record number of submissions this year.
The level of science from last year to this year has gone up immensely.
It's good that there is some dedicated time allotted to looking at the posters, discussing with the poster presenters, different scientific aspects of their work.
I've really enjoyed the hemodynamic lectures and actually getting exposed to the science behind unloading. There's no price for the longer sessions where they're able to go into the basic science of unloading and then how that relates to clinical practice.
I found it was a very good mix of basic research, of clinical impact, and a good number of presentations really to bring the field together, to bring the relevant specialists together and to find together a way to go forward.
And I think another thing ACURE did very nicely was explaining the history of hemodynamic support devices.
For myself as a clinical cardiologist, this is a rare and exciting opportunity to see the progress of all this work and how it translates ultimately into patient care.
This is really a point where we now start to completely rethink our clinical, how we treat our patients.
We are all involved with the objective of providing health, particularly from the two tools, the scientific tool and the educational tool.
ACURE brings together people from across different platforms, both at a basic science level and from a clinical level, brings them together and gets a great idea about what unloading and hemodynamic support mean in different clinical scenarios.
Nobody thinks recovery is possible, and here it's a whole conference dedicated to it with real data that shows that it's true.
This is going to change the face of medicine. It's going to be a major paradigm shift.
It's a really exciting time for mechanical unloading and recovery.